Hello, Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And as a practicing chiropractor who has a book on migraines and epilepsy, headaches are something I see often and have seen a lot of over the years. And there's a lot of miscommunication, poor communication as it relates to migraines, and a lot of misdiagnosis. Now, sometimes people become attached to their diagnosis and they don't want somebody to tell them that they don't have a migraine and maybe what they have is a structural type headache. But the challenge is that there's a lot of bleeding over. And if you happen to see a headache specialist and they don't touch your neck, then it might be time to find another one, because there's a lot of association between neck pain and migraines. And in this particular study, I'm going to talk about neck mobility. But that also means that if you're seeing somebody that they have to treat the musculature. So my strong recommendation be a chiropractor who also does soft tissue work. So working on the muscles, the ligaments, the tendons, the fascia, because you have to work on the muscles, you have to work on the joints. And if it's a true migraine, you have to understand how to improve the health of the blood vessels. You need a comprehensive approach, and there's very few providers that can do that. Most neurologists don't even touch the neck, don't understand how to treat the neck, and all they're going to do is use medication to address the headaches and not talk about the true comprehensive nature of what contributes to migraines, because migraines aren't a problem in the head, it's where you feel it, but they're a problem with the entire body. However, don't mistake your migraine headache for what I would consider a structural headache. I have had patients who are told they have migraines and 2 or 3 visits later their headaches are largely gone. Like, that wasn't the migraine, it was a misdiagnosed structural type headache that was coming from the head and the neck. So in this particular study, they looked at range of motion, so hypomobility, so less motion in specifically looking up at the ceiling, in a group of, there were 60 migraine and chronic migraine sufferers, and they compared it to 27 people who didn't have headaches, and they found that they had reduced neck mobility. Well, that shouldn't come as a big surprise, but if your primary care doctor if your neurologist did not touch your neck at all or look at range of motion, then they may be missing a big contributing factor to what is causing your headaches. And maybe that Topamax or that CGRP, the new class of drugs, that's not going to fix that. So, as always, I'm going to post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.